Good afternoon, everyone, and thank you for joining us this afternoon. The purpose of this joint press conference is to update the public around the COVID-19 virus, how it is currently impacting the Stockton community, and how we can protect ourselves and others from the severe side effects of the COVID-19 virus. We will provide the current data and information on this virus, the vaccinations, testing, and best practices from our local healthcare representatives. I would like to thank our local leaders here today, our Stockton City Council members, including Councilmember Dan Wright, who wanted to join us but was unable to join us this afternoon, San Joaquin County Health Officer, Dr. Maggie Park, Dr. Stephen Millar of Kaiser Permanente, and Dr. Scott Neeley of Dignity Health. As a city, the COVID-19 virus continues to impact our Stockton community. 90% of the COVID-19 cases in Stockton come from 6 districts within the 6 zip codes throughout the city of Stockton. Of those 6 zip codes, I wanted to share some key information from the top 4. The top 4 zip codes impacted by COVID-19 throughout the city of Stockton is 95205, accounting for 14% of the cases. 95209, accounting for 14% of the cases as well, and 95207, accounting for 16% of the cases, with 95206 accounting for 24% of the cases throughout Stockton. To date, Stockton has experienced over 37,000 cases of COVID-19. These percentages by zip code illustrate that COVID-19 is impacting every single district that our council members represent throughout the city of Stockton, which District 6, which is Councilmember Wormsley's district, has been disproportionately impacted by the virus. Just based off numbers, nearly 1 in 4 cases throughout the city of Stockton come from District 6. To date, Stockton has endured incredible loss, with over 806 residents no longer with us today, many of which having to fight through COVID and the virus in hospitals for months by themselves. Our children lost a year of in-person learning and time with friends, which has greatly impacted their social-emotional learning, which the impact is still yet to be determined. Our small business community was forced to adjust their business models, and some were faced with the difficult decisions to close their businesses after some of which over 20 years, 2 decades of service to our community. We're not yet out of this pandemic, and we must continue to stay educated on the facts surrounding this virus and use a data-driven approach to guide each and every one of our responses. As Stocktonians, we must stay diligent in our efforts to keep our families safe, to keep our children in the classroom, and to ensure our businesses can stay open. 77% of Stocktonians have received at least 1 dose of the COVID-19 vaccination. Our current vaccination percentage, some may say that it is an accomplishment, but it's not enough. It's absolutely critical that we continue to increase our vaccination rate throughout the city of Stockton. The vaccine is safe, the vaccine is effective, and is working to protect against some of the most severe side effects of the virus, including hospitalization and death. Our city is committed to working with our healthcare partners, our community-based organizations, to ensure our city has safe and equitable access to this life-saving tool. At this time, I'd like to introduce Dr. Park to come to the podium first to share the most current COVID-19 data for the city of Stockton and San Joaquin County. Dr. Park.
Thank you, Mayor Lincoln. for this opportunity to share recent data on COVID-19 and to talk about some trends we might be seeing in the future. San Joaquin County is currently experiencing a spike in COVID-19 cases. This wave began in early July as the Delta variant became the predominant circulating strain of the coronavirus. While other areas of the state might be starting to see their numbers stabilize, we continue to see rising case rates and hospitalization numbers here in Stockton and countywide. Our current daily numbers of confirmed positive cases and the number of people admitted to hospitals for COVID-19 now surpass the peak numbers we had during the wave of summer 2020. We knew that this surge might be as bad as last summer's, but we've passed last summer's numbers and still haven't reached the peak of this current surge. More than half of our ICU beds are occupied by COVID patients, and our ICU bed capacity use is at 136%. ICU bed availability is now below 10% for the San Joaquin Valley region. In addition, I want to bring attention to one concerning trend. We are seeing dramatic increases in case rates, particularly for our younger age groups, 0 to 4 and school-aged children. This is all the more reason for parents and caregivers of young children to get vaccinated. Vaccinating anyone eligible in a household 12 years of age or older adds protection to those who are younger or immunocompromised in the home. No one can say with certainty what will happen next in the progression of COVID-19 or its effect on our communities, but we can reflect on what has happened and look at what we're currently seeing as a precursor to what we might expect. We believe that COVID will become endemic, that we will not eradicate it, but like the seasonal flu, we'll learn to manage it, eventually resuming our pre-COVID lives. But until this happens, we will see more variants over time. The Delta variant accounted for 95% of cases in the month of July, and so far, all of the sequenced cases resulting for the month of August. We need to look now at the future, at the next variant, and prepare as best we can. Remember, we are in a race against variants. We are already looking at the need to give boosters to vaccinated individuals and planning now to make sure people get that added protection. We also foresee that the medical community and our community at large will have to address the issue of long COVID, where some individuals continue to experience lingering and often debilitating COVID symptoms. So our work will not be done, but we will get through this very hard part of COVID together. Let's continue to care for one another by masking, washing our hands, getting tested and staying home when sick, and by getting vaccinated. Vaccinations take place right here at the Stribley Center, and appointments can be made on myturn.ca.gov. Thank you so much, and now I'd like to introduce Dr. Stephen Millar from Kaiser Permanente.
Good afternoon, and I want to thank Dr. Park for all the wonderful work she's done for our community in terms of keeping us safe, and certainly thank Mayor Lincoln for inviting Kaiser Permanente to be a part of this event today. And we are really proud to stand alongside our partners in public health and in our community to really protect each and every member of our community from COVID-19 and in all the efforts that we are making to prevent COVID-19 from continuing to spread in our community and to hopefully finally turn a corner against this pandemic so that we can return to a more normal life. But we are really asking for everybody's help in this collective effort today so that we can all work together to bring this to an end and to regain some sense of normalcy in our lives. And we know that the safest way to do this and the most effective way is to be vaccinated. And at locations like this, we're giving out the vaccine to our community members so that we can protect you and your families. There are lots of ways that there are lots of reasons why we want to be vaccinated. Certainly individually, we want to be vaccinated, and I want to see you vaccinated so that you are healthy, so that you don't suffer, so that you feel well. And each of us certainly has that desire. Furthermore, I'm a pediatrician. And like Dr. Park mentioned, for the first time, we're starting to see a large number of children really getting affected by COVID-19. The disease itself, as well as all of the things that our kids have had to suffer through in the last year and a half, from disrupted learning to lack of play dates to inability to play sports with their friends. These are all impacts. And so to the degree that parents and caregivers and friends and family members are able to protect themselves with the vaccine when they are eligible, it provides protection for the kids that we see and interact with each and every day. So we encourage all family members and everybody eligible to get the vaccine to protect children so they can stay in school, participate in the sports and activities that they love and that we love watching them do. And finally, we ask that we get the vaccine to protect those who maybe have unseen illnesses or walk around amongst us at the grocery store with illnesses that we can't see, but that they have and that make them vulnerable to the most significant effects from COVID-19. And so really those are a lot of really good reasons to consider being vaccinated. But at the same time, we understand that many of you have questions. And these questions are legitimate, and we welcome them. This vaccine has now been given over 360 million doses as of Monday nationwide. So there's a tremendous amount of data that we have that proves its efficacy as well as its safety. We understand that many individuals will get some side effects, especially after the second dose: fever, fatigue, joint pains. We also know that many of those side effects indicate that your own immune system is actually working as it should to develop antibodies to provide you long-term protection so that you don't suffer the ill effects of COVID moving forward. And now that we have so much data, we can say that it's effective and that it is safe, and that we encourage you to really consider it for you and your family members. Dr. Park and her team have made every effort to make this accessible locally in your communities and in the zip codes that Mayor Lincoln outlined so that you can be a part of the solution moving forward. And we encourage all of you to look up on the website to schedule your appointments at myturn.ca.gov to schedule that appointment. And if you have further questions about the vaccine, feel free to reach out to your physician. Feel free to go to the cdc.gov website to get good information that will let you know the facts around this and how we can collectively work together to end the pandemic. So thank you very much, and I'd like to introduce Scott Neeley Dr. Scott Neeley from Dignity Health, and turn the time over to him. Thank you.
Thanks very much, Dr. Millar. That was fantastic, and good job, Maggie. I want to thank you, Mayor Lincoln, for asking Dignity Health to participate in this conference. And I want to say that at St. Joseph's Medical Center, part of Dignity Health, we're very proud to partner with our public health partners and with partners like Kaiser and Sutter to care for people in our community. We've cared for literally thousands of our citizens with COVID, as well as the other medical problems that keep happening during this pandemic. And we're really proud of our service to our community. On my rounds yesterday, the nurse that I spoke to told me about the patient who broke her heart. He was one of our neighbors here in Stockton. He was a man in his early 50s, married, a family man. At his age and in relatively good health, he had no reason to think that he would not have the opportunity to watch his grandchildren grow, to spend many more happy times with his loved ones and his friends. He was also determined not to receive a COVID vaccine up until the time he became ill. There are many reasons that people cite in support of their vaccine hesitancy, and in this case, our patient was concerned about side effects. But all of these reasons end with the same result: a person who's unprotected against severe COVID disease. As his oxygen levels declined and he became increasingly short of breath, our patient confided to his nurse, "This was a horrible mistake. I have never felt worse in my life. When I get out of here, I'm going to tell people to get the shot. I'm going to make sure that this doesn't happen to anybody else." Our patient died much too young. His was a life that was needlessly cut short, and his death was entirely preventable. And it was only one of dozens that we saw this past month alone in Stockton. The Delta variant of the SARS-CoV-2 virus is many times more infectious than the original variant that hit us 18 months ago. It is spreading faster, it is infecting younger patients, and it's causing very severe disease in these patients. Once again, our hospitals are full, our ICUs are over capacity, and we're taking care of critically ill patients in non-ICU areas due to our surge conditions. Our doctors, nurses, and respiratory therapists and other caregivers are working under tremendous strain, both to take care of the very large number of severely ill COVID patients and also to care for other patients who need urgent care, such as those experiencing heart attack, stroke, and other types of severe infection. But this time, with our healthcare system and providers under severe stress, we all know that these deaths, these severe illnesses, and this surge could have been avoided by more people receiving the vaccine. While the Delta strain of COVID is causing more infections in vaccinated individuals, the vaccine continues to limit the duration of illness and the duration of virus shedding, and thus still has utility in slowing the spread of the disease. More importantly, the vaccine is highly effective in preventing severe disease and hospitalization. Current estimates are that having been fully vaccinated reduces the risk of both severe disease and hospitalization by 25 to 30-fold. That's not a 25% reduction. That is a 96 to 97% reduction in the risk of severe disease, hospitalization, and death, and probably represents nearly complete elimination of risk of severe disease in individuals with normal immune systems. There are not two sets of facts about this disease and the vaccine. There is only the constantly evolving body of scientific and clinical data that comes from valid research. This work has established that adverse events associated with the vaccine are very rare and that it is much safer to receive a vaccine than to develop COVID, period. Tragically, there's a great deal of misunderstanding about this information available in the press and in social media, and a great deal of misinformation being promulgated. I do not harbor any anger towards people who are hesitant to receive the vaccine. I'm concerned about them, and I'm concerned about their families. In most cases, they are actually victims of misunderstanding and misinformation. And this misinformation is causing incalculable harm, and it is costing people their lives, just as it did our neighbor, who I began by telling you about. The best way for us to be safe and for our loved ones to be safe is to all be safe together. This means getting a vaccine, wearing a mask in indoor public places, and monitoring yourself and your loved ones for symptoms. If you have symptoms, you can get a reliable test by consulting sjready.org and finding a testing site offering truly valid results for you and your families. I'm very grateful to have had this opportunity to talk with you today, and I'd like to turn the conference back over to Mayor Lincoln. Thank you.
Thank you, Dr. Neeley, Dr. Millar, Dr. Park, and thank you to my colleagues on the council who are here represented today for your leadership and your commitment to the safety of the Stockton residents. We've proven as a city that we can unite together to meet and address some of the most pressing needs that our community has as a result of COVID-19. And we're committed to doing that moving forward, because we're better together. At this time, I'd like to open up the conversation, open up the mics to some of the media who would like to ask a few questions, and I'll facilitate and direct it to the appropriate representative here.
Hi, it's Kay Reseed with KCRA 3 News. I have two questions. In terms of the number of cases among children, and maybe Dr. Maggie Park, you can talk about this. You know, how many children are we seeing with COVID-19, and how does that compare to, you know, a month before or even weeks?
Sure, thank you for the question. And if you were to go to the San Joaquin County Public Health Services website, you would see under a data link that we have put out a report every Monday, Wednesday, and Friday with numbers. And the case rates that are rising that I was referring to would be labeled case rate by age. And what we're seeing is when we look at per group numbers, that the rates are rising. They've been rising across the board for younger age groups, not just the 0 to 4 and 5 to 17, but for some of the 25 to 34-year-old groups as well, and sometimes even the people into their 40s. But those are the numbers that I would be referring to. And if you were to look at them, and I try to pull them up right now, you would see that week over week, we've seen increases in the younger age population.
And then my second question, so Stanislaus County just announced that it is now mandatory to wear masks indoors despite your vaccination status. Could we be seeing something similar here in San Joaquin County?
Thank you for that question as well. At this point, our county has a strong recommendation to be wearing your masks indoors, whether you're vaccinated or not. We were early to do that, and we still stand behind that. We would really want people to take that as a strong recommendation and take it seriously, and hoping that as people take that seriously, they would put their masks back on and that they would be more inclined to protect themselves and those around them. And really watching our numbers over time and trying to decide whether it's going to be necessary to do such a mandate. Really hoping that a strong recommendation has driven people to do the right thing. And sometimes, to be honest, where it doesn't drive people, it's hard to know whether having a mandate would move the needle with people who are anti-maskers and mask-wearing refusers. I think really for us, we try to educate about the usefulness of masks and the effectiveness that they do supply.
Hi, this is Alejandra Quesada with Telemundo. I have been hearing a lot in other areas of the country about the use of ivermectin. A lot of people are self-medicating. Have we seen use of this in our region? Have we seen people arriving with overdose at the hospitals?
So we do believe that there is some use going on in our county, as we are hearing from feed supply stores that they're running out of ivermectin, and we're hearing from poison control that there's been some reports made by individuals that they've been affected. It's quite unfortunate that people are really leaning into this misinformation and hoping that there's a drug that will be a cure-all. As Dr. Neeley would tell you, there are many therapeutics available in the hospitals, but ivermectin is not one of them. It is not an FDA-approved drug for the use of COVID-19 treatment. It is in fact an anti-parasitic and not an antiviral, and many folks who are buying this over the counter are actually buying the kind that is for livestock and not for human use.
Once again, I'd like to thank everybody for coming and participating in this joint press conference this afternoon. This concludes the press conference. Have a wonderful day.